Hey guys, I'm Bryan Everitt. Welcome to the first medical directors meeting. We're going to go ahead and get started with a little bit of an introduction to myself. We'll talk about my background, a little bit of my expectations, and a little bit about how to contact me. So a little bit about me. I originally grew up in Charleston, South Carolina. Spent about 30 years there before moving out to Texas at the end of my medical school education. It's a great place to live. It's on the coast along the Atlantic Ocean. Lots of fun things to do there, and I encourage you if you get a chance to go visit. I went to college in Charleston at the Citadel, the Military College of South Carolina, a historic school, been around since the 1840s. It was a lot of fun there, made a lot of friends, studied biology. Actually spent 6 months in Australia studying there as well, which was a great bit of fun getting to explore Australia, explore the continent over there. While I was in college, I worked part-time for the Isle of Palms Fire Department. It's a small department with 2 stations, about 9 guys on shift, about 4 trucks. We also had our ability to do ocean rescue. It was a lot of fun working there during the summer, busy, busy, busy. And then if you worked during the winter, we didn't really do anything. It was I got to do a lot of cool things, including drive that E1 right there. It was originally Tower 1, but I think it's Tower 1001 now. While I was there, I got my EMT nationally registered. That was back in the day when you took it on a piece of paper. Great time. Got to do a whole bunch of cool things while I was there. I did my first intubation on a tennis court for cardiac arrest. And that was back when EMTs could intubate. In 2005, I joined Allendale, McClellanville Consolidated Fire Department. It was a volunteer rural area just outside of Mount Pleasant, where I lived. It's about 150 square miles, includes the national forest. Got to do a lot of wildland firefighting. I got to drive some tankers. Got to do a lot of the rural type of emergencies, landing helicopters, cutting people out of cars, long response times, but really interesting area. We have about 6 stations, 5 are manned, and it was a lot of fun. Got to kind of run the volunteer program there. Had a great experience. Fortunately, I had to leave as soon as we got a really great chief there. And really started kind of becoming a much more professional and well-developed station department. But it was for the best. I went to medical school, so that's why I left. In '09, I became a full-time firefighter at Isle of Palms Fire Department. There, I had worked on my national registry, got my national registry, and became paramedic there. We were FRO. We had a third service transport. Suburban, urban interface was a ton of fun. Some interesting things there. We had a port, so we had a decent-sized hazmat team. We had enough rescues from high angle for that bridge that was in the very first picture, so we had a pretty decent rescue team. I had a airport in our area, so I was on the ARF truck for a while, so I have aircraft rescue training and hazmat training and some other things. So was a lot of fun. When I left there, I was one of the medical training officers. I was in that Suburban, that Tahoe right there. Pretty sweet, fun gig. It was a ton of fun. Got to go to all cardiac arrest, all structure fires. Was a great experience. Had a lot of learning about medical education. I taught EMT class. A lot of learning about how to do simulation, put into practice some of the things that we wanted to do and the quality measures we wanted to accomplish. So that's kind of my background when it comes to EMS and kind of setting that up. So a little proof that I actually did fight fire back in the day. I had a lot of fun doing it, but I remember how hard it was, how sweaty you get, and I love my air-conditioned job now. So in 2013, I got accepted to the University of South Carolina School of Medicine. I moved to Columbia, South Carolina, the capital of South Carolina, and started school there. I lasted about 6 months outside the fire service before I joined the Columbia Fire Department, which was a rural urban fire service. Kind of an interesting situation I could go on and talking about, but what was cool is if we get the left out of our station, we went rural and we're in the county. If we went right outside of our station, we became in the city, and we fought alongside the city firefighters there because we're all in the same department. It's just different. We had different looking trucks, and you could have volunteers at your volunteer stations, and then full time paid people at other stations. So it was a real good time. We had it was an FRO. We were basics. We didn't have paramedics, so it was fun to be the only paramedic on some areas. Got to do some fun things out in the field. Had a lot of stabbing, shootings. Had a lot of structure fires and some brush fires while I was there. My last fire ever getting fired was a car fire right in front of our station. So unfortunately left there in 2017 when I came out to Texas to begin a emergency medicine residency at UTESCA. I loved every minute of my residency. It was incredibly busy, fun-filled. The university offered me some really interesting opportunities. I got to be a part of 2 mass casualties while there. My very first one was in the first month I was here as a resident intern. I got to intubate one of the guys from the truck full of immigrants that showed up that had been left to die. So got to manage him, do some hypothermia management. It was really interesting. I also was in the hospital on Southern Springs and went down to the trauma bay to receive patients there. I got to manage a few of the children that were brought in, shot, and a couple of the adults when they arrived. So been interesting opportunities, been, able to learn a lot, and then put that into the field. Why I started my fellowship here at the UTESCA. Great year, great opportunity, meeting everybody. Learned a ton from working with the Office of the Medical Director, working with all those very smart doctors there. I hope to be able to put a lot of that education here in the area that will be medical director of in the next couple months, and also bringing out fellows to enjoy and learn from you all as well. So I am currently taking over the medical direction of the East Side. Have 4 departments right now, which is exciting. Basically all kind of run together, work together. It was fun to go on a structure fire the other day where pretty much everybody, I think, except ESD 12 was there fighting fires. So I am very proud to be over here. I think that there is a ton of opportunity, some very motivated individuals, some very interesting learning opportunities for me and the fellows. And I think it's exciting to see everybody's enthusiasm and at wanting to move medical care to the next level. It's been a great breath of fresh air for me, and I'm really excited to get started with everybody. So that being said, let's get into some of my expectations. You may have seen the email and kind of clicked on this video, and I kind of wrote out a little bit, but kind of go over, I expect you to do everything that needs to be done for the patient, regardless of how long it's going to be till the ambulance gets there or until we're going to get to the hospital. I also think everybody is an extremely important part of the patient's care, and I believe in career resource management, that it doesn't matter what level you are, whether you're a basic, intermediate, or paramedic, you have an important role in taking care of a patient. You need to know your role in that, and you need to own that role. And if you see something, say something. So I want you to treat our patients like you would a fire. If they are critically ill, you are going to be aggressive with fighting that fire. And I want you to be aggressive with managing the patient. That means airway, breathing, circulation support, finding ways to reduce their pain, trying to support them, managing what needs to be managed aggressively that needs to be done. This is extremely important in critical patients, but it also matters with the daily patient. If they're in pain, treat the pain. If they're having chest pain, get the 12 lead. I don't care how long until the medic unit shows up. Go ahead and start that process. That's going to reduce the amount of time that a patient needs to be waiting for care. So that's extremely important to me. I expect our care to be patient-centered, okay? And that means that we have to do not just the normal medicine that we normally do, but that also means like taking a moment to take care of patients' physical needs, psychosocial needs, and prevent them from having needs for us. So physical needs, maybe giving them stuff for pain so that they aren't in any more pain. Making sure their dignity was respected, trying to cover them, keep them warm, keep them cool, depending on what they need. And then addressing basic needs. Sometimes that's enough to calm down an agitated psych patient. Maybe they need some water, maybe they need some food, maybe they need to get out of the rain. I don't know what that might be on each individual occasion, but we should always be trying to address their basic needs as we can. We also need to take some psychosocial. These patients are tending to have a bad day. If they're calling us, it's a bad day. And it may not seem like a bad day to us. We may be like, really, it's 3 o'clock in the morning and you stubbed your toe. But maybe just taking a moment to have some empathy for them, listening to what they're doing. And sometimes the best thing you can do for patients when they're kind of upset or scared or whatever is just explaining to them the process. Hey, we're here. We're going to take care of you. We're not going to leave you. You're going to get in the ambulance. The ambulance is going to take you to the hospital. The doctor is going to talk to you there, and then they're going to do some tests. And that's how we're going to move forward at this moment. And that really alleviates a lot of the patient's anxieties, allows them to feel in control of what's going on and kind of helping them out. And then preventing, educating patients on fall prevention, such as removing rugs if they have had a fall, making sure that they know that how to take their medications, how to take their sugar if they're diabetic. Just doing those small educational type things to try and help patients make sure that they are getting better. And then following up with patients. That's something we don't normally do, but every now and then, if you have like a patient that you're interested in what happened, going by and seeing them, saying hi. If you're interested, you have a frequent flyer, you just want to prevent them from calling you. Sometimes all you have to do is stop by and say, how are you doing? So we are really going to push for patient-centered care. We want to make sure that anything we do is towards improving the patient's well-being, reducing their need for us, and making sure that we are respecting them as human beings. I expect everybody to be professional in both our appearance and performance of our duties and our interactions with other professionals in our arena. So if we do that, nobody can ever accuse us of doing something wrong. If we are patient-centered and we are professional in our performance, we will always be approved. So I'm probably echoing what your chiefs have told you. If you look the part, people will think you look the part. So making sure your equipment's clean, making sure you know where stuff is, making sure everything's in working order. You're trying to present your best appearance that you can as a professional. We want you to know your skills, know your level of certification skills-wise, be able to perform those. That means you may have to sit around and practice different things multiple times. Trust me, there's enough. Putting on a tourniquet is not as easy as most people think it is. It takes practice. You should practice on how to do these different skills that you have. So when the time comes, you have that ability. And then, of course, there's another educational component about handoff and important handoff and having a respectful and professional manner when working with other colleagues. I expect you to maintain that, and as long as you do that, there's nothing that can ever be said about that. I would check out our pin up here to make sure that you can see the patient handoff lecture. We're going to be evidence-based. Dogma in EMS is dead, and we're going to continue to kill off the dogmatic things. For example, long spine boards. We finally got rid of those. Be flexible. Things will change fast. There may be something that comes out, and we try to implement it. You may gain function, you may lose function. It just depends. If we find things don't work, we're going to change it. We really strive to reduce the amount of medications that you guys have to carry and making sure that things that we carry are multiple uses. I really want to see everybody doing what's best and constantly trying to keep up on the latest and greatest. I encourage you to participate in the protocol development committees in each department where we discuss each of the kind of protocols and look at the evidence and make sure that we're doing what's best. And if there's a change to be made, we'll make the change. I encourage you to read up, and if you find something interesting you want to try, let me know. I'm happy to look and evaluate it and how it fits into our medical care. This will push us to be the best in the area and best in the country. We're going to push that envelope as much as we can because that's what I believe in. And finally, I want you to have fun doing what you do. This job is stressful enough, okay? There's enough, making sure the truck's checked off, making sure it's clean, making sure that, all the other duties of the day are done, and then you got to go take care of patients when they may be on their worst day. So I encourage you to have fun with what you're doing. I put this up here that safety is third. I don't claim that your safety is number one. I'm always worried about your safety, but we got to assess risk and we need to evaluate risks as they go. And then we got to do our job that we have to do. We need to look good doing it. So we need to be professional and know what we're doing well. And finally, we need to balance our safety in that area. If our safety was first, we wouldn't go into structure fires. But yeah, we do, because we balance the risks and benefits and we make the sacrifice that we need to make. And the same goes for medicine. I expect that same thing as you. There's a link to an article that explains this a little further, and I'll probably have one of the authors of that article come talk to you all about that and another medical director minute in the future. So this being said, I am an open book for you guys. I want to be, one, you to know my face, one, to know who I am, and one, know how to get in contact with me. So you can, there's 3 different ways you can get in contact with me. The first and most easiest way is to go to BCMDR channel and call for BXMD2. If you can't remember my number, just say doctor or medical direction or something else. I'm going to pick up and say, hey, how's it going? In fact, I answer the dispatcher most times because I didn't hear who they were calling. I'm just like, what unit was calling? So that's it. Number one, at least give me 2 tries. Give me about like 30 seconds in between each try, so that I can get a chance to answer it. Sometimes it's on the other side of the house. Sometimes I'm doing something else and I just need to get to it. I can't carry it everywhere I go during my day. For example, if I'm working out, it doesn't come with me. So if that doesn't work, you can always call my phone number. It's 843-906-6748. If it's not something urgent, you can email me, ask a question at utusca.edu, and I will answer it as properly as I can. It's important to understand when to contact me. So if you have a question during a call, after a call, just randomly, call me, talk to me. I'm happy to do it. I'm happy to talk to you. And it really doesn't matter what time of day. To be honest with you, I'm a nocturnist, so probably during the morning is probably not the best time to call me, but night, 2 a.m., probably just fine. If there is a colleague that recommends medical direction, give us a call. For example, like use of blood and traumatic injuries. If it's a complicated high-risk refusal, you got someone that has abnormal vital signs trying to refuse. You have someone that is having a stroke and they're trying to refuse. These type of things are reasons to call me. If you really want a patient to go, you think a patient should go to the hospital, and one way to kind of improve their chances of going if they're refusing to you is to have them talk to a doctor. Although I'm going to say nothing different than what you've already said, for some reason, talking to a doctor increases their chance of going to the hospital. Um, if you're unsure what to do, you got a complex case. It's weird. Even if it's part of the protocols, I'm there to help you. My job is to know all the protocols, know about how to work with patients, and how to figure out what the best care is going to be. If you want to do something outside your scope because you think it's needed for a patient, I'm happy for you to give me a call and we'll discuss whether or not that's an appropriate care move. If you have a disagreement about patient care with another provider, I really encourage you to handle this after the shift. But if it's something you think is very significant, you can contact me and we can have a discussion in that plan. I encourage you not to do this in front of patients, but sometimes I understand that there are disagreements and there needs to be a third party involved. Anytime we're pronouncing a patient, unless otherwise in the COGS, such as obvious deaths, but I need you to give me a call so we can make sure that we have a doctor on to pronounce. And then again, any questions you might have. If you just want to get in touch with me, give me a call. One way to improve and make sure that the information gets across quickly is after you call, state what you want is. And, hi, doc, this is, first state who you are. This is medic, whatever, paramedic blank. I'm on scene with a 34-year-old female requesting X, requesting termination, requesting medications, requesting, well, that allows me to get my mind going and kind of start thinking about what is going to be the next step and kind of plan what's going on. Then you're going to kind of give me the story, some vitals, what you've done so far, basically the same turnover that you would give another when you're transferring the patient, you're doing handoff. And again, if you want to hear more about that, check up here. Again, I might have pointed to the wrong side of the screen. It's going to be on one of these two areas. So that being said, if there's anything after you get that, expect some questions. Expect me to ask a few things to try and clarify and justify my decision making. Sometimes it will just be like, yeah, go ahead and do it. Other times it may be, no, I need a little bit more information. Finally, we have a tough job. Things happen. People have medical emergencies. People have issues with like mental health or feeling depressed. I am always available. If one of our firefighters goes to the hospital, I want to know about it. If anybody's struggling with something and they just need someone to listen and talk to, I'm available. Give me a call. I will make time or find someone that can make time. We will handle it. I am here for you, for your medical direction. I'm here to support you in your medical mission, and I'm here to support you guys throughout. Remember, I am a firefighter. I still consider myself a firefighter. And I know that this job is tough and there's a lot of trauma that you unfortunately witness. I know that there's a lot of other things in life that affect our ability to do our jobs. And if you ever need anything, please let me know, and I'll do whatever I can to help. So just on a final note, I just wanted to share with you my family. My beautiful wife, Cassie. We just got married a couple months ago. Had a wonderful wedding. She's a very big partner with me. She's always supported me in all the things I do. And you probably will meet her if you haven't already. and she's also a emergency nurse, so she kind of gets it. So she's a very, very, very helpful, and I'm happy to have her. And then I got my the bomb there, my old boy Logan. He's about 12 years old. We've been together forever. He's kind of been my man, thick and strong. And then we have our new puppy, which is a French bulldog. He is a bundle of energy and is a ton of fun. But that Stitch is his name, and it's Stitch and Logan, me and Cassie. So, uh, guys, I'm like I said, I'm always here. Always got the radio on. If I don't have it, give me a call on the phone. Always have that at least. And if nothing else, shoot me an email. Look forward to seeing everybody out there in the street. You will see me out either running calls or riding with you to try and learn about quality and make sure everybody's getting the equal education that we can do, and kind of teaching them little tidbits while we're out there riding. But really, I just am out there to hang out and enjoy the fire station lifestyle. So, guys, that's basically it. If you got any questions, email me. If you got any interesting endnotes, email me. I'm always happy to talk to everybody. I look forward to seeing you guys out there in the field. So, thank you.